I just encourage you to stand up a little bit. And before we watch a best movie, we always need popcorn. So do you have your popcorn?
We typically are the ones who always present at this time for the orientation, so we know all of you are probably about ready to fall asleep, and now you're having more carbohydrates, so you probably really doze off on us. We promise to try to keep it as interesting as we can. I'm Sally Ropey.
And I'm Issa Chase. I work in Franklin, the southeast part of Milwaukee County.
And I am the school nurse for the Wauwatosa School District. We have 7,500 kids in 14 different building sites. I'm the only full-time nurse.
I have 7 buildings, 1 high school, 1 middle school, and 5 elementary schools. I'm the only nurse there. We hired just this past spring a second nurse for the rec department for before and after school programs, and also for the their summer camp. But I'm it. So we need to do some delegation. So today we'd like to share with you some of wonderful experience with delegation and some kind of things that we learned along the way.
A lot of what's on here has come from periodicals, documents, nursing journals, and for the most part I tried to list them at the end of things. But if you become a member of WASN, you're also a member of NASN, which will give you a copy of this every once in a while, plus the Journal of School Nursing. And there's quite a bit in here that we've taken out of these particular documents. There are also things that we found from other places that we've used over the years. And actually, this picture on this is one of my favorite. It's this little bitty thing with a backpack that's bigger than she is, sort of running to get to the schoolhouse. So sometimes they have some of the cutest stuff on here. But there's a lot of information in here. It's a very concise document, and it has fairly short articles. And anybody who would like to see what these look like, to have some idea, you're welcome to come up and take a look when we're done.
Well, in a school setting, you're probably the only healthcare provider, and it's hard to be the broker between different languages. We are used to the medical language, and now we're learning a whole new different foreign language. It's IEPs, 504s, and CD, whatever. They are working on RTI, PBIS. So it's a different world. And also, they may not fully understand the scope of nursing practice, that you have to really safeguard that license that we all hold so dear, and we're not willing to really delegate if it's not the proper way.
I think the other piece I had, an associate principal told me once, well, we don't need you just to write down a bunch of stuff and have the doctor sign it, as far as a health plan or emergency plan goes. Again, they don't get the whole idea of nursing process and the common language and the way we all think. And in order to get a doctor to sign something, we all know it has to be done the right way. This layperson wasn't familiar with all that. So I do all the work, the doctor signs, and all of a sudden it's official. We know that. But there's a way to go about then making sure that whatever is in that health plan or that emergency action plan gets done. It gets done appropriately and in a way that you feel you can go home at night and sleep okay. I found this quite a while ago, so way back in Flo's time, before any of us were a blink in our mom's eyes. She talked about people working together. The simple question in her head was not how can I always do this right thing myself, but how can I provide for this right thing to always be done. Not necessarily that even the nurses back then were trying to do it all, but trying to train other people to help the soldiers that were in these field hospitals.
So working together it's part of what we do, and traditionally we interact with others and we complement each other. We try to, I say at schools, at my schools, I try to surround myself with people I can trust, with people I know that are knowledgeable, and then I would like to help them to become competent.
Since working with others has always been a fundamental aspect of nursing, We have always delegated, always. So coming to school nursing, it sometimes seems like a massive issue. But if you've worked in hospitals or clinics, you did delegation there too. It may just have been different. If you worked in hospitals or clinics, you may even have taught parents how to care for their kids or people to go home and administer their own injectable medications. So now we take it out of that medical clinical environment and we try to figure out how to fit it in to a school environment and do it in such a way that everybody understands what needs to be done.
And for the most part, even our Board of Nursing was a little confused about this process, this whole, the legality of it. So we're still working on it to, as school nurses, to assert ourselves and really define how is delegation done in schools, in school settings, and then how can it be done safely. And we describe the process as building and sustaining trust in connections among students, school nurses, and unlicensed assistant personnel.
Now there's a lot of stuff on this screen, and in your handout, some of these are kind of hard to read, and I apologize. It took me half an hour to figure out how to print those handouts. And so with the computer program I have, I just thought, I'm lucky it's on paper. So we'll try looking at the slides. The delegating nurse in the UAP, or the unlicensed assistive personnel receiving delegation, should be prepared to enter the nursing delegation process. Again, it's a process. The nurse is prepared to delegate through appropriate education, skills, and experience. My experience and their experience. So it's kind of a twofold thing. So all of that underneath it is included in that. You need to be able yourself to understand the delegating process. You need to understand the role and scope of functions of what your unlicensed people that you're delegating to are responsible for and what they can do. You need to bring in a line of authority that allows you, the nurse, to enforce the delegation. Part of that would be too, if you are given someone to train to do a procedure and you in your gut know they can't do it, you can go to the principal and say, this person is not a good fit for this role. So that's another part of it. Necessary knowledge, skill, and professional judgment to perform the nursing tasks, functions, and activities to be delegated. So the years of experience you've had working in nursing environments, clinical environments, hospitals. Access to pertinent client information, access to pertinent staff information, as well as relevant agency or district policies, procedures, and guidelines. An opportunity to provide communication, surveillance, and supervision of the people you are delegating to, and how the kids are handling whatever is being done to them, and consistent availability of you to all those folks for consultation and direction if something isn't going right.
So to delegate or not to delegate, what's a school nurse to do? You have to put a really critical thinking hat, and for each situation, make sure that you have really assessed not just the patient, the student who needs a procedure done. You have to assess the whole situation and what context is this supposed to happen, and who is available, what are the resources, and who has what background. So look at the tasks, and do you you have available at that building? Who is the designated person that the principal is telling you it's available to do that procedure? Do they have the knowledge, the skill to perform? Whatever background they have, does it make them competent? You know, it's sometimes a simple thing just to take a temperature or blood pressure as part of the delegation. But then if one person doesn't get it, you know, you have to reconsider that whole process. We have to be able also to communicate what is being delegated, and it should be clear, concise, and always at their disposal. They need to be trained as part of this delegation, not just say, this is how you do a cath, let me see, and I'll check you off. I like to see this as a process. I say, you tell me when you're ready for me not to be here, because I wanted to be here and answer any questions until you feel that you are competent, and I feel that you are competent.
You must go to the next one.
Yeah. And the communication it's both ways. And we're going to see this give and take of responsibility and also accountability it's a two-way street.
We've got the position of NASN being that the delegation of nursing tasks in the school setting can be a valuable tool. And they can, because it's a means to take care of special needs kids. It's a means to take care of kids who may need help during an emergency situation. It's a way to keep things consistent and concise again. And it's a way not only to do the delegation, but also to have written guidelines or written instructions that are for the child that has to have the procedure done. NASN takes the position, too, that UAPs can positively support the provision of student health care, but only when the school nurse determines its appropriateness and conducts the proper training and supervision, and when the school staff, parents, and primary health care providers are apprised of the role parameters of a UAP and the legal responsibilities of delegation. I've had conversations with physicians telling them, I am the only school nurse in the district. I am not in their patient's building at all times. They sometimes seem to think that the nurse can just come up to wherever this child is and do these things. So they don't always have a good idea either. And often when I explain that, we can come up to a different decision as to how we're going to do what needs to be done for that child during the day. And then it's up to me to figure out who in the building, with the help of the principal, would be the logical people to help me with that process.
In every state, the nursing board who give us our license, they sometimes define what can be delegated in some states, and some states, like Wisconsin, they don't have a laundry list of things that we can and cannot delegate. So it's a gives us a little power to be able to say, you know, this I'm not comfortable delegating, or this I'm comfortable delegating. Or if you get into a more higher skill level of nursing, you have to consult with the experts. I often call the pulmonary clinics in the state with kids with trach, with being decannulated, and that what level of skilled nurse do I need to provide support for this student in my building. So we may not have the background and expertise in all of the things that we need to delegate, but that doesn't give us the excuse of not delegating either. If you're not comfortable, go back. We have resources in most part of the states that we can go back and be trained ourselves again. And then our organization also supports continuing education, and that you always keep yourself up to date with what's state of art in our profession. So steps of delegation.
These are the questions I've asked myself for years when I get a child and I stand there and go, I don't think I can do this, and I've ended up doing it. I usually want to know, what kind of care will this child need at school? Have they received this care before? Has it been consistent? Has their response to it been a consistent response? Who provided it? Mom, dad, a nurse at home, whoever. I'm trying to get information. Is there a predictable response on the part of the student to the procedure that's done? What is that? What does it look like? Have the care and response to care been fairly static? Does this kid tolerate this? It's not an issue. It's, you know, you'll hear parents say, it's not a big deal. If I can learn it, you're a nurse, you can learn it. But then I have to learn it the way nurses have to learn it. So sometimes they don't understand that either. What's the likelihood of an emergency or risk in providing this care? So you build in all those pieces as you're doing probably that more extensive IHP for a kid like this. And you build in the emergency pieces as well.
So let's communicate. How can this task be accomplished? And then what information is to be reported? Concerns, what do they need to learn? And then what are the parents concerned? What do the students have concerns? Sometimes we overlook the students' right to have things done for them in in a certain ways. They may not be comfortable with certain different gender or different things. And when you look at the being culture sensitive, a lot of different cultures do not even allow you to be cared by a person of another gender. So let's take all of those things in consideration, and then keep communicating and document. We'll document the task completed with a timely fashion. People have a hard time thinking that, why do I have to do this every time? Why do I have to document every time? We understand, but then we have to help them to understand.
And understand they need to do it in ink, not in pencil, crayon, or colored marker. This is the surveillance and supervision piece. And I have trained people to do things and then gone back later. I told them I'll come back and spot check what's happening once they're comfortable and I'm comfortable. Some people get really paranoid about this. But it's the only way I can keep a handle on what's going on and what things look like. I have gone back and observed some toileting procedures, and the procedure itself is fine, but the environment is filthy because the people helping with it aren't going to clean up the mess that's there, and our janitorial staff doesn't go into that bathroom very often. So I needed to be there to see that this place was a risk to anybody who walked into it, and we had to have it cleaned on a regular basis. And I was the one who finally did the footwork and found the head custodian and got all of it going. But the staff didn't tell me how dirty the place was. So again, there was more to it. Anybody could have done this. It didn't take the nurse, but I walk in and we are doing toileting, and we have kids who can't risk getting sick, and we have stool on the grab handle, and we have a mess on the toilet seat. Not acceptable. Not acceptable. So sometimes what you do is clean up, literally. Sometimes what you do is just a matter of walking in and reassuring yourself things are going the way you think it should be.
But I would like you to take time to read one of the articles that was published by the National Association of School Nurses. That one that's titled 3 different concepts of knowledge, trust, and empowerment. I thought when I read that kind of put in a framework that I could understand. I said, I have to be able to know that this person I'm delegating has the knowledge to do this. They know why is it being done, why does it need to be done, and when does it need to be done, and how does it need to be done. But I also need to trust that once I'm not in the building, they're doing what they're supposed to be doing the way that was delegated. So when I spoke about responsibility and accountability, I turned my back, but I believe that you're going to follow through with what I said. And if I don't have that trust, if I have someone that broke that trust, it makes the whole process of delegation, to me, very uncomfortable. Now, I have to either try to understand with this person why is this going on, because the responsibilities that you are going to perform as I am delegating. I have responsibility for the outcome. I am accountable for my patient's assessment, evaluation, and I'm also accountable for the whole outcome of the whole situation. So if it is something that is not going the way it is supposed to be, I like the last concept is the empowerment. I am going to make sure that I'm empowering you to call me, to let me know, and to reach out for me to make the situation better. If it is a dirty environment, if we need shelves to really protect the equipment and the supplies in a more proper manner, I want to empower this person I'm delegating, because custodians may poo-poo what an assistant is telling them, but then if the school nurse comes, they listen a little better. So they have to feel that empowerment, that I am a phone call away, and if they have any questions, I will pick it up and I will talk to them. And I will go there if I need to, depending on the situation. And that from time to time, I also go there and say, how are things going? Is it going better, or, is things getting better? So they have that trust, empowerment, and also that they feel that they are knowledgeable, that they're not certain about something they can ask.
Encourage that. I had a special ed teacher outstep his bounds once, and he told the assistants working in his classroom that in order for anything to come to me, they had to tell him, and he would call me. And what it was, he decided whether or not it was something I even needed to know. No, it wasn't a very nice situation. I want those people performing that one-on-one care, putting their eyes and their hands on that student, to be the ones talking to me always. And so we straightened that up. That's the only time that has ever happened, but that's not acceptable. I need to talk to the people who are actually providing the care.
So sometimes I get a phone call and say, I'm the principal at such and such school. I need you to delegate this. I said, I choose for my license what to delegate. And they know now, most of them, if I get a new one from time to time, they'll get the lecture. So you have to tell me who are the designated individuals in your building available for me to delegate what I think is proper to delegate. What is the task? What does it need to be done? And how is it going to be done? I need to assess the student. I need to really do a thorough evaluation of the whole situation, and then see if the personnel that you have designated in your building is a good fit, is a good match for what I need to be accomplishing in your building. So you need to start building that that position of school nurse, one of not just power, because power without trust, or without, really for them to understand where you're coming from. They hear legalities. They hear that, the school is more liable if something goes wrong with the student, if they do something wrong. They listen to those things, but sometimes we need to clarify things.
Intervention. It's necessary, again, if you've got problems that arise or concerns that come up. We've kind of talked about some of that intervention piece. You've got problems with somebody who just consistently isn't getting it done when it needs to be done. And I love the age-old, medicine's not late if it's a half an hour before or half an hour after the scheduled time it needs to be given. And I have people who will try to apply that then to everything. Catheterizations, G-tube feedings, and I've told them, no, sorry, it's a singular issue. It's just for medication. But what you're doing, that child needs to eat lunch when they need to eat lunch. I also look at all the logs that come in, and I look at times that things were done, because everything, again, is documented. They don't often see the purpose to that, but that's the nursing anal retentive issue I think we all learn in school. So. And plus, we do third-party billing, if any of you have heard of that, and we use our logs for that purpose. If there's an unexpected change in a student's condition, all of a sudden, this kid's not reacting right. This is not how they have been when they've gotten their G2 feedings in the past. Something isn't right. I need to know. I probably need to go to school. I probably need to call parents. Changing tasks or functions to meet expectations if they aren't working out. I do that. They don't do that. I had some UAPs who thought maybe just somebody, they'd draw up the med and then they could put it in the pack, and then when they were all at the ballpark, the other person would then be responsible for giving it. And guess what happened in this whole chain of they all thought it would work this way? It didn't get given. It was a seizure med. So the rule is, if you draw it up, you give it. You are not drawing it up for somebody else to give. It doesn't work that way, and you shouldn't be drawing it up ahead of time anyway. And does that UAP have difficulty performing the task? I had someone in a school office, principal said, I want this person and this person to learn how to help this diabetic child. Well, this person could manage blood sugars, but if you got a needle bigger than the lancet, the woman practically passed out on the floor. Was not a logical candidate. So we did have her help with blood sugars. She did learn that whole process of what do you do if it's high, what do you do if it's low, but we had to have other people who took over with dosing and other things that needed to be done. So she could learn part of it, but it was very clear to the principal that that was all she could do.
And sometimes what principals and school personnel don't understand is that because I train you doesn't mean that you can train somebody else. And while she knows, she can show so-and-so how to do it. Doesn't work
They
like
can
that.
watch.
Yes.
They can watch, but they can't put hands on and they can't do a darn thing until I'm there.
I said, have them observe, Mary do it a couple of times. I'll meet her there on the third day, and I'll go step by step what needs to be done, and I'll train her. But it sometimes gets a little confusing.
The 5 rights of medication administration, you kind of have the 5 rights of delegation as well. You've got the right task, circumstances, the right person, right directions and communication, and under the right supervision and evaluation. We have some principles of delegation. These came from a joint statement from, I think it was from the National School Boards of Nursing. A school nurse can delegate elements of care, but does not delegate the nursing process.
So when you look at the assessment, that's yours. The nursing diagnosis is yours. The goals are yours. You set those. When it comes to intervention, then you can delegate some of the interventions. What are examples of things that you can delegate? You can teach somebody how to take a pulse. I want to know if we have a pulse ox, put that on their finger, tell me the numbers. You can easily do those things. You can teach somebody, take a blood pressure, tell me you're supervising some student with diabetes, or you're telling them, teach them how to look at the peak flow meter. You can delegate all of those different tasks. That is part of your whole intervention. Then when it comes to your evaluation, that's yours to keep. And that is also closing the process. And through the year, it's not just to supervise the person you delegated to, it's also to keep monitoring how is the student tolerating the procedure, how are they responding to it. So it's critical thinking, and it's a professional judgment. And I often add to that, and that's what I went to school for.
This is probably another slide in your handout that's very difficult to read. And we have an exercise we want to do, so why don't we skip a couple of these. I added this is new, and these 2 issues of NASA's School Nurse, there are articles. There was Article 1 and Article 2 on delegation and using a skills-based assessment of the person who's performing a task. One of the things they bring out, it's something I've done because it makes parents who've been the sole care provider for a child who's quite young, and all of a sudden they're turning them over to a public school with people they don't know who are all of a sudden going to change their diaper, do breathing treatments, do G-tube treatments, give them their medication and their G-tube. And no one's ever done that but mom or dad. Have a family member come in and have them do the procedure with people watching. I always tell staff they may not do it the way I'm going to tell you to do it exactly, because we're going to stress more with cleanliness, wearing gloves, things like that. But look at what mom does or dad does, and look at how the child reacts to that. Plus it makes that parent feel more connected, and they feel safer leaving their child there.
And I say it's a wonderful opportunity for us to get together as a group and for the child to learn. These are the people at school that can help you. These are the people that are going to take care of you. So they know the face. They know who is going to take care of them. And it's also continuity of care. We see how mom does and what works for the child, how the child is responding. So we use that as a model for approaching the child.
And again, a lot of people always say, I can't delegate. They can't assess someone. I'm the only one who can do that. You're not asking them to assess. You're asking them to use their eyes to tell you what they see, to read a number, to know when a number isn't the right number, whatever it is, whether it is pulse ox, blood pressure, pulse, whatever you're dealing with, and so that they know that if the number should be 10 and it's now 20, that they should be getting on the phone to call somebody. So again, they recognize and they report. They're not, you're the one who in your head then is thinking of all the reasons why all of a sudden this kid has a number that's that high. And your decision to go directly to that school to take a look at that child or to call the parents. But they're there every day. They know what the child normally looks like. They are just reporting to you that this number isn't right and this is what the child looks like to them right then.